Eric Benson to tell us his story. And Eric, you've got a great story, and I really appreciate you sharing that.
Yeah, sure. So I'll start. I'll give like a quick. Uh, oh, oh, I thought I just hung up on you. Uh, a quick history of what my wife has gone through. She was diagnosed with a rare sarcoma called undifferentiated pleomorphic sarcoma with spindle cell high grade in December of 2022. It was in her left thigh, and from before it was diagnosed, it was growing, and it looked like a just like a muscle spasm constantly. But by the time they did surgery, after I don't even know how many rounds of radiation they did to stop it, it was 17 and a half pounds and 33 centimeters long. And it ate all of the quadriceps in her left leg. So she has no more quadriceps in her leg, and walking is difficult. Um, we thought we were done with that, but then it got infected, and she had to have 3 debridement surgeries, which took even more tissue away from her leg. And everything was good at that point, we thought, until February of 2024, when we found out it metastasized to the right side of her neck. This one, when it was first caught, was 2 centimeters, and it grew to 9 centimeters in like a month and a half. It was removed in March of 2024, but came back and was 9 centimeters again by April of 2024. And this time it was deemed inoperable because it had now wrapped around the carotid artery and was sitting on and in the brachial nerve plexus on her right shoulder. So she did radiation. I think this time it was 25 rounds. That took 2 months. We decided that she was going to do chemo because it was so big and so aggressive. It was still 9 centimeters at that point. She started a very aggressive form of chemotherapy called AIM, and that's the initials for the 3 meds that she had to be on that would be administered over 3 days in the hospital every 3 weeks. And she was supposed to get 6 rounds of that, but round 4 pretty much almost killed her because she was having a neurotoxic reaction to one of the medicines. So that extended that stay by a few days while everything got worked out. So they switched her from that form of chemotherapy to just now 1 drug every 3 weeks. And that started in December of 2024. She did 4 rounds of that. During that time, all along, they take measurements and do scans every 3 months. She started taking the Coriolus Versicolor pills, the Enforce, on January 1st, and we did see differences compared to prior to that. The tumor on just the super strong chemo before it almost killed her went from 9 centimeters to 7 centimeters from August to November of 2024. Then in December is when she started the lesser strength chemo. Didn't get any measurements just from that, but her last scans were in March, and it went from 7 centimeters in December to 3 centimeters in March. During that time, she was on the Coriolus Versicolor, and I'm giving her 12 a day. And the last blood test she had, all of her like liver function, kidney function, everything is in normal range now, whereas before it hadn't been normal in 2 years. We do the next scan in June, and we're hoping to see even more improvements because we can't even feel it under the skin now. It was over her collarbone, and now we can feel her collarbone again.
Wow.
So that's the short version.
Wow, that's awesome, Eric. Thank you so much, brother.
Yeah, and as I said before, once we get that other scan, I'll let you know how it's going.
Oh, please do. Yeah, we'll be interested in hearing updates.
Sure.
Awesome. Thank you so much. God bless you guys.
Yeah.
Anyways, I'll take anyone else jumping in and giving us their story. Don't be shy.
Hello.
Yes, Deborah.
Hi there. How are you doing, Dr. Jerry?
Good, doing good. How about you?
I am not doing so well. I have had severe neuropathy in my feet and legs for about 5 years. And I was a flight attendant for American Airlines. I flew for 48 years. And then I finally came in on my last Hong Kong trip on January the 8th, 2020. And I just said, that's it. I couldn't stand on an airplane that long. And so, are there any success stories that you know of where the Coriolus versicolor has helped neuropathy?
Yeah, there are many,
There,
in fact.
Barry's waving at you.
Yeah, we'll bring Barry on, but yeah, Deborah, who brought you in?
Jill Baker. Brenda Marks is my upline.
Oh, okay. I will send Brenda some testimonials and it'll work its way to you.
Okay. So I
They're-
I,
they're-
I placed my $499 order about a week ago, and I finally got the product in. And so my friend Kay Parker, you may be aware of her. She was on
Right.
she was on her deathbed when I last saw her, and I've been friends with her for like 40 years. And so when I talked to her, she said, "Deb, I'm off all of my medication. My heart problems are solved. I don't have any more arthritis." And she had gone completely blind a year before she went home from the rehab center. And now she had recovered her entire eyesight. So I asked her, how much of this Coriolus versicolor were you taking? And she said, I would take 5 at night and 5 in the morning. So I went to my chiropractor today and he muscle tested me on it. And he said, this is a great product for you.
Because a typical mushroom extract doesn't have the purity that this one does, or the efficacy, or the just the purity. I would follow your intuition personally, and I think the 5 twice is probably a good amount. But yeah, anyway,
Okay.
I will send Brenda something and make sure it gets to you, Deborah Jones.
Okay, but just to be really brief, are there successes with neuropathy?
Yes.
Oh my God. I'll
We
tell you
have to
something.
we have to say that this product doesn't treat or cure, but what it does is it does it really well, is it feeds your immune system in a special way, and the immune system supports your life. And neuropathy is a complex etiology. It has many different etiological factors, causes, and we tracked many of these things originated in the gut, affecting the liver, affecting the brain. It's a complex thing, but you need to support those systems, and the Coriolus versicolor does support the miracle of life and support all of those systems. So just know that.
Okay. Thank you, Dr. Jerry. I'm going to tell you,
Thank you.
if I'm going to start back on the 5 in the morning, 5 at night, and I'm getting ready to order some more because I became my own customer. So I'm going to go in there and edit my order for the next shipment. But I will tell you that I will be the biggest mouthpiece for this if this has a positive effect on my neuropathy.
That's awesome. Be patient, because neuropathy is one of those degenerated things that takes many, many decades to get to where you are right now. But be patient and watch for the signposts. But you'll see that we have had success there. I'll send some evidence of that to you. Thank you.
Thank you so much, Dr. Jerry.
Dr. Jerry, this is Shelly.
Yeah, Shelly.
Hi, I'd like to address this gal's comments. I have had some, not a terrible neuropathy, but some neuropathy in my feet for a long time. And I've had a lot of pain in my feet, to the point that I got to, and I'm in my 70s. The point I got to was I almost dreaded getting out of bed in the morning, because I knew that those first steps were going to be very painful. And as the day would go on, it would be a little bit better. But I got to the point that I quit wearing shoes that I had bought that at the time I got them, we're very comfortable, and I have a job where I do a lot of walking, but I had put a lot of those shoes away because I just couldn't wear them. I couldn't walk in them. And after I started on the Coriolus Versicolor mushroom, and I've used some of the other products now too, and I've been on the products now for I think about 8 or 10 weeks, not that long. I am at the point now where I don't even think about putting my feet down on the floor when I get out of bed.
Oh my
And
God.
for somebody like me, I mean, and I'm not going to lie here, I can still feel my feet, and it's a little bit uncomfortable, but I don't have any pain. And I think we all know that, it's not real good to not feel like you can walk. And frankly, I don't want to be somebody who has to be in a wheelchair or a walker or whatever. So I'm able to do my job now. I'm able to walk, excuse me, a long way without having to think about it. It takes us a long time to get where we're at in the degenerative process. And we have to allow our bodies to start to heal. This gal, just be patient. And I take now 3 and 3, but I started out with 5 and 5. So
Oh, wow.
so that's what I can offer to her, and maybe anybody else that has a lot of pain in their feet.
Well,
Thank you, Shelly.
I want to tell you something. I appreciate your testimonial so much, because when I step down on the floor in the morning, I feel like I'm stepping on a million shards of broken glass.
I get it. I understand.
And now I
Just-
have some hope.
Yep. I'm glad, Deborah. I just hang in there.
Yes, I will. Thank you so much for your testimonial. And thank you, Jerry, for letting her give her testimonial.
Absolutely.
You're
Yeah, thank
welcome.
you. Yeah, it's a little frustrating to me, but we get a lot of this, that people get these immediate results. The body doesn't get sick immediately, typically, at least in the serious disease. That happens over decades. And to reverse it does require some patience, but you'll see the signposts. How long, Shelly, have you been taking the Inforce?
I had to unmute myself. I started in, I think I signed up at the end of March, and I got my products like a week and a half later. So it's only been maybe 7 weeks.
Yeah.
And I knew enough Dr. Jerry to not expect an overnight miracle. I
Right.
just knew that if I kept doing what I was doing, that I would just, like you say, watch the signpost. So